when I'm low. She take me high. I can teach you all the sound of love.
Hi guys, and welcome back. Thank you for joining me once again, but sure to hit the subscribe button and go ahead so you know when I drop a fire mixtape. Just kidding, when I drop a video. So today we're going to be discussing what I feel are nursing must-haves, what you have to have. The first thing I have for you guys today is a laptop, tablet, whatever it is that you feel more comfortable with. Microsoft Surface, I believe this is a 2. When I tell you that this is life, this is better than a MacBook, better than, yeah, you heard it, I said it, I don't regret it. Like, this is on point. The reason why I love this so much is that you don't need a laptop and a tablet. All you need is this. This bad boy is a laptop and a tablet. You can change the interface, so when you want to work on computer stuff, you can make it, you know, attach the keyboard, make it all like a whole desktop, and then when you're ready just to live life, you can completely turn it into a tablet. I totally love the dual function of it. So the next item I have is a stethoscope. Personally, I got my first stethoscope from the bookstore, and I got it for like 10 bucks. In nursing school, I don't suggest going out and buying an expensive stethoscope because the chances of you losing it are very high. I always feel if you look good, you feel good. I am an advocate for that. So the next item I have is get you a good pair of scrubs. Now, you don't have to go expensive, super expensive. We use scrubs that we purchased from the school, so we didn't have to go looking anywhere. I personally, after graduating, I went and I bought scrubs from Jaanuu. You heard? Jaanuu, however you pronounce it. Those scrubs are bomb. Now, boys, I don't know if, or men, I don't know if they make them for guys, but they definitely make it for ladies. Ladies, go check it out. Their scrubs are bomb, on point. I love it, I love it. I always get compliments on it, and it is a nice mix between trendy and yet usable, because that's the thing. You don't want to get something too flashy but doesn't have the necessities like pockets.
Tons of pockets. A whole lot of pockets. You need a lot of pockets.
The next I would say are a good pair of shoes. Shoes, fam. You think I'm playing? Like, you're on your feet for so long, you need a good pair of shoes. So yesterday, by accident, I went and I purchased a new pair of shoes. I honestly have never worn the clogs, the nurse shoes, because one of my coworkers tripped in them, like fractured their ankles or something. I don't know. Ever since then, I'm like, I will stick to what I know. So I have worn Roches. I'm a Nike diehard fan. But yesterday, I walked into the store and I saw these shoes and I like them. I like shoes that have a little spark, a little design, you know, a little flair of me. So I got these and I can tell you, like, I love them so far. I have not worn them. That's why they're in here. That's why I'm touching them, loving on them. Once I wear them to work, I'm never gonna bring them. But these are my bad boys. They're so cute. I love it. I love the little accent here. But the reason why I got this is because they said therapeutic. So they conned me. It said therapeutic. And I was like, you know what? Let me try these out and we'll see how it goes. Now, once I wear these shoes, they will not step foot outside like 3 steps of my front door. Once I come back from work, these shoes go in a little cubby. And I suggest that for all your work shoes, only because the hospital is a very dirty place. You're walking in between blood, you know, sputum, all sorts of disgusting germs. You do not want to bring it home to your loved one, your kids, your family. So just leave your shoes. Have a designated spot for your scrub shoes, your shoes or your scrubs, so you can just keep them there and you don't have to worry about transferring germs. The next item I have, which I feel like I have been deprived my whole life. My whole nursing career, ain't nobody told me about these. These are God's blessing to nurses everywhere. I kid you not. Like, y'all gonna think I'm crazy, but it's totally worth it. And they are compression socks. Yes, compression socks. Look at these. Look at these cuties. And they smell good because I just washed them. But these are compression socks. So basically what they do is they keep your veins and they keep your blood circulating throughout your feet, so you don't get not cramps, but you don't get clots down in your feet, which is possible from standing in a place for a long time, which is what we do. We stand charting, we're in a patient's room standing and talking to them for, 15 to 20 to 30 minutes, sometimes an hour if you got a chatty box patient. So I love these. After I wore them, I did not wear them when I first started working. My feet were hurting. After that, I got these. Bam. my feet don't hurt at all. And I got these off of Amazon. I know other places sell it, but I mean, for me, this works just fine. After a while, you do need to replace them. So after a couple of months, just make sure you go out and get another one. These are like $9. They're really, really awesome. Like, get you some, okay? Treat yourself. As I mentioned in my previous video, go check it out if you haven't, but organization is a big part of nursing school. You need to be organized. So next, I feel you should have either a planner or a phone or even a calendar. That way you can always write out when your assignments are due, when projects are due, and you will never miss a date. Clipboards. Clipboards. These, I use them for clinicals. I found that these were A1 and handy for when I had clinical paperwork. There's a clip. Ooh, you can just clip your paperwork right there, or you can put all your things in here. In here, I put clinical paperwork, I put pens, highlighter, paper, whatever it is I needed. I put it all in here, and it went with me everywhere for that clinical day. I had two. One for different clinicals. Just be sure to get two different colors. That way you don't grab the wrong clipboard for the wrong clinical. In terms of book, I can make another video going into details into what type of books you should get. You don't need to get every single book that they tell you you have to get. Keep in mind, be resourceful and be wise about the way you spend your money in buying books. Not all books you have to have, but one book that I highly recommend is the heavy hitter. So this is a Saunders Comprehensive NCLEX review book, and for me this book was clutch. I wish I knew about this book when I first started out. I just found out about it towards the end of my semesters, and it was very good when reviewing for the NCLEX in totality. What I do love about this book is that it breaks down the learning into different sections. So you have adult, geriatric, pediatric, fundamentals, and I just feel like this is worth the money. So go ahead. You don't have to get the latest edition if that's too expensive. You can go an edition below that, but nonetheless, get this. Totally worth it. Well, another book that I used for the entirety of my nursing program was this bad boy right here. Sparks and Taylor's Nursing Diagnosis Reference Manual. Now this is what our school made us get. Your school probably makes you get another one, but if you were to buy any book, this would be the book that you should buy, because for every clinicals we had to do clinical paperwork, which entailed having to write a care plan, which basically came from this bad boy. So having this and having your own copy so you can annotate, so you can write in it, so you can, you know, put your sticky tabs in it for the different care plans that I used redundantly. You know, I dog-ear them so I don't have to keep going to the index and flipping back and forth. So this book, definitely used it. It has a lot of wear and tear. So yeah, this is a keeper. Another fave would be this Pharm Plash. One of the other things that I wish I knew about when I was starting, I only found out about it when I was reviewing for the NCLEX. This right here, look at this. Remember this. This right here is just amazing. It breaks down each different drugs and it tells you what the classification is. It tells you, you know, indication, what else? the class. What I really do love about it is tells you what to keep in mind, which is basically what you should tell the patients. That was in our clinical paperwork when we're doing our meds. We had to write, you know, a little segment on what the patient needs to know. This has it right here. This really is just simple, and that's why I like it. You can find most drugs in here. If not, you have the internet, but definitely recommend this. So last and definitely not least by any means would be clinical judgment, clinical reasoning. Clinical judgment reasoning is basically how you make choices based on your observation that you gathered, plus based on your brain, and you know, how you solutionsly solve things, how you come about to have solutions to problems. For example, if you see that a patient just had surgery and they have not gotten up, they're just in bed laying down, and you notice that you listen to their breath sounds and you realize that, man, their breath sounds really shallow. What is going on? Your clinical judgment reasoning would be, hey, they've been sitting flat on their back for so long that their alveoli, all their lungs, is just, it's becoming deflated. Let's get them up. Let's get them walking, because walking expands your lungs. It keeps the air coming in and out so that your lungs are stretching, expanding with inspiration and expiration. Or you can give them an IS and they can just breathe in and out. But anyway, thinking such like that you cannot buy. It comes with time. And I tell you, every day as a new nurse, I'm constantly learning. I'm constantly expanding my clinical judgment. And granted, you're not going to have the clinical judgment of a highly experienced nurse. And for me, that's very tough. When I'm at work and I'm like, dang, how come I didn't catch that, man? I thought everything was fine. I didn't see anything wrong. But a lot of times, nurses learn from previous mistakes of others and or mistakes of themselves. Once you've encountered a mistake that you've made, the chances are, unless if you're just blatantly not trying to improve, you're never going to make that mistake again, because you're like, whoa, like I remember that exact moment, or I remember when such a situation happened. So the chances of you repeating it again, it's going to be less likely. Okay? So I believe that's all the items I have today. If you feel like I missed anything or you would like to add anything to the list, be sure to comment. And also subscribe. What's up? You like what I'm dishing? You don't like? Let me know, okay? Subscribe, like, stay connected. And as always, have a great day. Turn up responsibly and whatnot. And peace. Notebook, stethoscope.